good to see you. You can go ahead and have a seat. And what's your name? Okay. Before we get started, can I get your date of birth? Okay. And would you spell your last name for me, please? Okay. Now, is this your first time to the dermatologist? It is? Okay. Well, there's not really anything to expect. It's not a very big deal at all. I think you'll find it's a pretty easy process. So, first, just tell me what brings you here. Okay. Absolutely. It's a fairly common problem. Breakouts can be persistent, and as you probably know, it can be caused by just about anything. Stress, hormones, lack of sleep, diet change. Really, all kinds of factors can come into play and make your skin misbehave. Yes, you've been dealing with this for several years. It can be frustrating to try to figure out what works for you, so after all that time, it's probably smart to come here, and I think that we'll get something that can clear it up. So, I want to do a little examination of your skin. Can you tell me a little bit about your skin type? Is it oily? Is it dry? A little oily? That makes sense. The oil can lead to more breakouts. It's more common that we see breakouts in oilier skin types. And, okay, so you mostly have it in your T-zone, your forehead, your nose. You might have a little extra oil here in your cheeks, yeah. And is it particularly dry around the outside? It is. It can be tough to balance that, but I can give you some guidance on what to do with your skincare, and it should also help you to clear up your acne. Okay. And are you wearing any makeup or anything like that? Clean skin. Great. I'm going to take a little look at your skin. I'm going to feel it and just see if I notice anything unusual before I get any further. I am going to put on some gloves just because you are having some breakouts. I don't want to risk adding any extra bacteria or anything like that to your skin, okay? I normally wouldn't do this every time, but since it's your first visit, I just want to get a feel. Take my ring off. Okay. And have you used any prescriptions before for your skin? Alright. Now just sit straight up and look right at me, okay? Just your chin right there. Okay. Just want to feel all around and see if there are any lumps or just hot spots. And I'm just taking a general inspection. Turn your head this way. Around your cheeks. And sometimes you can have a buildup right here in the creases where your nose is. That's fairly common too. Just like to be thorough. Okay, good. Just another second. And once I've got a good evaluation of your skin, we won't have to do this in future visits. Okay, and I'm going to check around your neck a little bit as well. Do you have any breakouts really any lower, or is it just the face? Okay. And is there a particular area of your face where the breakouts are worse? Right. And I can kind of see that. So you don't really get them on your forehead much, but you do get them around your chin and your jaw. Okay. Well, everything seems healthy and normal. Just going to write down a few notes so we can build up a folder for you for when you come back. Okay. So now I've got a really good feel for your skin, and I'd like to take a closer look at your actual breakouts so I can decide what the best thing would be to prescribe to clear them up. I've got a really bright light, and I'm going to look very closely and try to determine what you might need. So just keep sitting right there, nice and still. This is really bright, but I promise I won't shine it in your eyes. Okay? I'm going to get really close. Mhm. Good. Doing good. I'm going to cover up your eyes a little. Now I think I know exactly what you need to clear this up. When I see this type of acne, we have a gel that is very effective for about 85% of the people that we prescribe it to. This is something that is very effective, but it's fairly mild too. So I think you'll find, like most of my patients, it's very well tolerated and it shouldn't irritate your skin at all. What this is a combination gel, so it has some antibiotic and it's also got a retinoic acid. And retinoic acid is a type of vitamin A. Together these are really powerful to clear out this type of acne, again without irritating the skin like I said. So this should help when other methods at home have failed to get rid of this frustrating type. Alright, now before I prescribe it to you, I like to try it in office. Even though it is mild, I like to make sure before I send you home that you won't have any type of adverse reaction right away. So I'm going to take a Q-tip and I'm going to apply just a little bit on the affected areas just to make sure, like I said, that you don't have any problems. I am using this, but at home you can use your clean fingertips. It'll be just fine. And when you're applying this, you want to make sure that you treat your fingers like little feathers, very gently. Just smooth it across your skin and don't pull or scrub it in. And you only need to use it on the affected areas. So in your case, there's no need to put any on your forehead or your nose. You can just put it around your chin, your cheeks, and those places. Only use just as much as you need. Don't use a whole lot of this. Okay. So I'm going to apply this on your cheeks. On the other side. Good. Very good. And I'm just inspecting and keeping an eye on your skin. Let me know if you feel anything unusual, okay? Being extra gentle. And finally, get your chin. you feeling any tingling or burning? No? Everything feels normal? Good. Yeah, it does have a little bit of a smell to it, but I don't think it's a bad smell. Not at all. Okay. It's been a few minutes, and it seems like everything's reacting perfectly normally, so I think you're going to be just fine with this. It is very mild. What I'm going to do is send you home with several of these samples, and I'm just going to go ahead and bag them up before I forget. Okay, so you have several sample tubes of this, and I'm also going to write you a prescription for a couple of months. Now, and I'm going to put this prescription in your bag with your samples. I've written this down for you, but what you need to do is apply this twice a day, okay, like I said, very gently, okay, and you want to do it morning and night, about 12 hours apart if you can, right after you wash your face. I do want to talk about your skincare a little bit because that can make a difference in your acne as well. So do you use any other lotions or creams? You do. An oil-reducing lotion. Sure. Now, do you know if that contains salicylic acid? That's what it's called. It does. Alright. I would recommend that you stop using that now that I've prescribed you the cream. And you just want to use what I've given you without anything else if you can help it. When you add extra product, it can irritate your skin and overstimulate it. So you want to try and use the bare minimum whenever possible. Okay? And I mentioned you want to put this on right after you wash your face. Do you wash your face just with water in the shower? Do you use a cleanser? You have a wash. Okay. With cleansers, this is really up to you. What I would suggest is that you find one with as little perfume in it or fragrance as possible, and if it's fragrance-free, that's even better, especially since your skin's a little bit irritated right now. So something fragrance-free. Let me write this down for you as well. You want to find one that's fragrance-free and clear, really simple cleanser when possible. Nothing fancy. Okay. And there is a process with washing your face that I'd suggest to you. So when you do it, what you want to do is, of course, get your face wet, and this can be with just nice lukewarm water. Some people use it really, really cold because they think it constricts their skin better or something. It doesn't make a difference, and you're only irritating your skin and freezing your face in the mornings. So just don't use hot water or particularly cold. Get it comfortable, wash your face, well, get it wet, and when you have your cleanser, put it into your hand and emulsify that. Okay, get it nice and sudsed up. Then really briefly and gently, a lot like your gel, just slide it on carefully and get all the areas of your face, but you don't need to scrub because it's just going to irritate your skin. So do this for no more than 10 seconds. The cleanser is going to do the work for you. Get it on, and after about 10 seconds, you want to get your water in your hands like this and splash it onto your face. So you keep doing that until you've rinsed off all the cleanser, and as soon as it's gone, just stop. Do that for as little as possible, but make sure to rinse everything off. Okay. And then when you dry your skin with your towel, you don't want to scrub. Just take it and pat dry very gently. So the whole key is to be nice and kind to your skin, and it will help you out. Because you have the breakouts largely around your chin and your jawline, I'll ask you, do you exercise? Okay, that's perfectly fine. I know it's difficult to find the time to do it, but if you want to try working out maybe 2 to 3 times a week, even a nice brisk walk outside, what this can do is help to regulate your hormones, and it can regulate your moods even, and really just purify your skin. It can only help, and it'll increase blood flow, all kinds of good stuff. So I'd recommend exercising, since this tends to be hormonal in this area. And of course, make sure that you're getting as much rest as you can, drinking lots of water, everything like that. One more really important thing I want to talk about, since I gave you that prescription, is do you wear sunscreen? Okay, a lot of people don't. I think you should start wearing sunscreen for sure, and you should wear it anyway. But an SPF 30, really anything more than that, you're just getting more chemical without a lot more marginal protection. So SPF 30 is fine, something fragrance-free and as gentle as possible that you can find. And just apply enough. It has to be fairly liberal for it to be effective. A lot of people do use sunscreen, but they don't use enough. So if you need to get up 5 minutes earlier in the morning just to make sure it has time to absorb and everything, then that's okay. And you'll forget about it for the rest of the day. You just want to make sure when you're headed to your car, checking the mail and things, that you're protected, because that prescription can make you more vulnerable to the sun's rays. So I'd recommend in the daytime you apply your sunscreen every day. And that'll be like a nice 3-step process for you. Cleanse, put on your prescription, give that a few minutes to dry and set, and then your sunscreen. Okay, very important, because that retinoic acid will make you more vulnerable. And the nighttime will be nice and simple. You can continue using any eye creams or anything like that that you're doing. Just make sure that nothing is getting too far down into where you break out, because you do want to make sure that you're using as little product as possible, like we talked about. Now, you're going to try this prescription out for 2 months. When you leave here, you can talk to the receptionist, and she'll get you all set up. We'll have you back here in 60 days, because after that time, when you've been consistently using the prescription, we can really tell if it's working or not. That isn't to say that it'll take 2 months for it to clear up. You'll probably see a result within a couple weeks. But after 2 months, we can be sure if it's helping or not. And if it is, I'll write you a longer prescription so you can stay on it. If it's not, we'll find something else and keep trying. I do have a high confidence for this product to help you out, because it's been very effective. So be consistent, be gentle, and we'll see you in 2 months. Okay? Now, do you have any questions for me? Okay. Was it pleasant enough for you? Not too bad? Good. Well, it was very nice to meet you, and I look forward to seeing you in 2 months. Good luck to you. Alright, bye-bye.